Welcome everyone to the launch of the textbook of Occupational Medicine, the 5th edition, brought to you by World Scientific Publishing. Before we begin, please take note of a few housekeeping rules. We would appreciate if your microphones could remain muted during the course of this launch. However, you are free to keep your cameras on if you wish. If you have any other questions at the end of the launch, I'll put it in the question box and I'll read it out at the end. And also, please note that this webinar will be recorded and posted online. Thank you very much. Today, we are very fortunate that we have our guest of honor, Adjunct Associate Professor Matthias Porto, to join the launch along with our book editors, Professor David Ko and Dr. Gan Ho. Now, let us start with the book launch with a message from Adjunct Associate Professor Matthias Porto. Welcome, Professor Matthias.
Yeah, thank you very much. And good afternoon, Professor David Ko, Dr. Gan Ho, our fellow colleagues and friends. It gives me great pleasure to be with you this evening to launch the 5th edition of the textbook of Occupational Medicine Practice. So time flies, and it is already the 28th month of the COVID pandemic globally. And since the beginning of 2020, our fellows of the Academy of Medicine and residents who work in public health and occupational medicine have been busy managing patients, workers, and populations during this pandemic. And particularly during the months of April to August of 2020, if you remember, close to almost 50,000 workers in Singapore, mainly from the purpose-built and factory-converted dormitories, were infected with COVID-19 and had to be isolated and treated. So many of our esteemed colleagues have actually gone into looking after the workers and the patients. And fast forward to April this year, after a large Delta variant wave and now a more massive Omicron variant wave, we have weathered the ups and downs and have become more resilient as a nation and as a united community of occupational medicine and public health practitioners. So we would not have succeeded without the close partnership of our workers, the employers, the general public, as well as the healthcare professionals in Singapore. So I also was looking at the role of our occupational medicine physicians, and it has evolved over time. So that, the traditional designated family doctors are now known as designated workplace doctors, and the role has expanded. So besides conducting medical examinations for workers, our OM practitioners are also providing more preventive and public health care. So from individualized care of a patient to managing large working populations, our OM practitioners need to partake in continuous professional education and a lifelong journey of learning new skills and technology. So I was just reflecting that a successful OM practitioner not only possesses the latest evidence to care for patients, he also needs to understand the local context, the local laws and ethics. He also has to be a great communicator, and in times of crisis, to be able to communicate, educate, and inform clients and the working populations and their families. So back to the launch of the 5th edition of the textbook of Occupational Medicine Practice today. I was just looking back at the time when Professor J. Jayaratnam and David Ko from the COFM department, at that time it was still known as the Community Occupational and Family Medicine Department at NUS, first conceptualized and pioneered the authorship and compendium of this local occupational medicine textbook in 1996. And that was with the hope of inspiring our postgraduate and undergraduate students in occupational medicine to improve the care of the working population. And I still remember that 5 years later, in 2001, the 2nd edition was launched, again with Professor David Ko leading, with Prof. Chaki Singh and Professor Jayaratnam. And I myself have a copy of this edition, and it is easy to read and comprehend, covering the essentials of occupational medicine training. And a decade later, in 2011, probably after the H1N1 epidemic at that time, a 3rd edition was compiled and edited again by Professor David Ko and with Professor Ken Takahashi. And at the time, new editions were added, including chapters on occupational infections, metabolic disorders, OM practice, and the law. And again, in 2017, we had the 4th edition, this time partnering with Professor Ching. And now, 5 years after the 4th edition, Professor David Koh, once again with Dr. Gan Wee Ho, have successfully updated and revised this edition in the midst of the current COVID-19 pandemic, together with many local and international authors who specialize in occupational medicine and other medical specialties. So the features of this new edition is that it has been substantially revised and updated to reflect significant changes in the healthcare practice, and also incorporates the explosion of information since the advent of the 4th Industrial Revolution and the COVID-19 pandemic. And there will be a new section relating to the multidisciplinary nature of occupational health practice, with added topics such as OM practice and the law, ethics in occupational medicine, how to do audits and evidence-based OM practice, as well as crisis communication. So really, this book contains a rich collection of case studies and illustrations. And I'm most certain that this textbook of occupational medicine practice will be a precious gem to the busy medical practitioner, whether it's a general practitioner or specialist, as well as our allied health and safety professionals, our students and residents who are embarking on occupational medicine training. So I feel that the learners of this 21st century are very blessed with this new textbook, now available in print and soon in the electronic format. So once again, I would like to congratulate the key editors, Professor David Koh and Dr. Gan Wee Ho, on the launch of this 5th edition of the textbook of occupational health practice. And may this legacy of David and Wee Ho and their co-authors ignite interest and spur further research and development for the care of workers around the world. Yeah. Thank you very much.
Thank you very much, Adjunct Associate Professor Matthias. Now, we are going to play some videos in the coming session. We have a video message from Professor Yik Ying To, the Dean of Saw Swee Hock School of Public Health in the National University of Singapore, on the launch of our new edition of the book. The video is from the occupational resident who has read the book. Also, we have the contributors of the book who share their journeys in writing the chapters. Thank you, Sikling.
Hello, everyone. I'm delighted to be given the opportunity to say a few words during the launch of the 5th edition of the textbook of occupational medicine practice. So this has been edited by Professor David Koh and Dr. Gan Wee Ho, two outstanding public health physicians whose authority in occupational medicine and health is recognized not just locally in Singapore, but also by peers in OM around the world. I do believe the 5th edition of the textbook comes at a very timely moment. So the world is finally at the stage where we are starting to see the recovery from the COVID-19 pandemic. Not only has the SARS-CoV-2 virus redefined the importance of workplace health and safety, the fact that the average working adult spend more than a third of their waking moment at the workplace highlights the impact that an unhealthy or risky work environment can have on a person's health and well-being. The domain of occupational medicine has rightly expanded into occupational health, where not only do we see the role of reducing hazards and risk at the workplace to be paramount, but also it is important to develop environments that promote health-seeking behaviors. And as such, I'm delighted to see that there are specific chapters on work and health, mental health disorders, and on health screening and periodic medical examinations. All these are valuable opportunities for maintaining, improving, and protecting the health of the workforce. Congratulations, David and Wee Ho, for your editorial supervision of the textbook. May this be one of the chapters in your legacy in public health.
Hi, this is Goh Chi Leok from the National Skin Center, Singapore. I want to congratulate David Ko and Gan Wei Ho for the publication of the 5th edition of their textbook of occupational medicine practice. I am privileged and honored to be a contributor to the book. I wish the publisher and editors all the best for the launch of the book today.
Hi, David. Hi, Riho. Congratulations on the launch of the latest edition, the 5th edition of the textbook of occupational medicine practice. I still remember using this book during my MMed days, and I am glad that the current residents will have access to this very useful textbook.
Good day to you, ladies and gentlemen. We are extremely delighted to be part of this textbook of occupational medicine practice, and the changing landscape of occupational medicine with incorporation of traditional and contemporary topics in this book provides a different dimension and assistance to occupational medicine practitioners. Prof. David Ko and Dr. Gan did an awesome job to get this book in reality, and accolades also go up to World Scientific, the publisher of this book. Congratulations. We hope this book will be an impetus for the practice of occupational medicine globally. Thank you.
Hello everyone, and greetings from Belfast, Northern Ireland. I'm Ken Adley, and it has been a great privilege for me and my colleague Dr. Robert Kerr from the Ulster University to have been given the opportunity to update our chapter on mental health and work. Of course, the COVID-19 pandemic has added to the complexity and importance of mental well-being for all workers, but in particular for those in frontline jobs, including healthcare settings. We wish David Ko and Wei Ho Gan every success with the new edition of the book.
I'm very privileged to have contributed to the textbook of occupational medicine since the first edition in 1996. Now, one challenge I face as a contributor is to ensure that new, important, and relevant materials are incorporated. COVID is an example. COVID has defined our lives in the past 2 years. Its inclusion in the chapter on ethics and law becomes a compelling lesson on the basic values of human decency and fairness for humanity, including all at work. I would like to thank the editors and the team for the opportunity to contribute to the textbook. Thank you.
I wish to congratulate Prof. David Ko and Dr. Gan Wei Ho the successful launch of the 5th edition of the textbook of occupational medicine. I wish to thank Prof. David Ko for the opportunity to be an author of this book. I foresee this textbook to be a global clinical reference to a diverse group of medical practitioners, primary care physicians, allied health and safety professionals, and medical students. It was indeed a pleasant experience to revise a chapter on hepatobiliary and gastrointestinal disorders, which was first authored by none other than a guru of occupational medicine, the late Prof. Alta Ching, which was nostalgia for me going down memory lane. Thank you.
About 2 years ago, Professor David Ko and I conceptualized writing a brand new chapter about the multidisciplinary nature of occupational health practice. We were so passionate because having multidisciplinary knowledge and expertise helps occupational health practitioners to become more adaptable to the rapidly changing environment. This chapter covers toxicology, epidemiology, occupational hygiene, biomonitoring, and case studies. With multidisciplinary knowledge, we believe we can do better in occupational health.
I would like to congratulate Professor Dr. David Ko and Dr. Gan Wei Ho on the launch of the textbook of occupational medicine practice, the 5th edition. I have enjoyed working with Dr. Aileen Razali on the chapter on auditory disorders. I would like to thank Prof. David Ko for inviting me again to write for this textbook of occupational medicine practice. Thank you very much, and all the best for the launch.
Congratulations, Prof. David Ko and Dr. Gan Wei Ho on the launch of the textbook of occupational medicine practice. 5th edition, how about that? It has been a great privilege to be working on the chapter of this book alongside Prof. Rampal, and here's to many, many more editions to come. Congrats again, Prof. David, Dr. Gan. Stay safe and stay healthy.
Hi, I am Dr. Hugh Rees. I am a specialist in occupational medicine based at the School of Medicine in Cardiff University, United Kingdom. I led the writing of the chapter on renal disorders, along with two specialist renal physicians, Professor Stephen Riley, also from Cardiff, and Doris Chan from Adelaide in Australia. I would like to make 3 points. First of all, I found it valuable to work with specialist physicians like this, and there was quite a lot of two-way traffic between the three of us in terms of learning. Secondly, in preparing the chapter, I was struck by how much of the new evidence was coming from Asian countries. And I guess that reflects the change in manufacturing bases across the world, away from Europe and to a lesser extent the USA to Asian countries. Thirdly, as far as I know, this is the only occupational medicine textbook specializing in clinical aspects. And I think that is very valuable indeed. And I look forward to it being made available in a digital format that will increase its accessibility to students and clinicians. So that is all from me. Bye for now.
Hello everybody. Joining with Professor David Ko and Dr. Gan Wee Ho in this 5th edition of Textbook of Occupational Medicine is my exceptional experience. I have a chance to contribute to this textbook in the 4th edition. The editors required to create explanation and example of the cases in the aspect of the chapter, and that is fun in writing and in reading this textbook. In Thailand, this is one of the standard textbooks for us occupational medicine physicians and those who are concerned in the field of preventive medicine. In this post-COVID era, the world of work will be changed. I think more international workers will work together. The cultural aspect of occupational medicine will be more and more important to be understood and practiced. In the 5th edition, I revised this chapter. I hope you will enjoy this useful textbook like me. Thank you very much.
We would like to thank you for the congratulations messages from everyone. It's been
I'd like to
meaningful
first
to the
congratulate
launch of
Prof.
this.
Ko and Dr. Gan on the
Pardon
successful
me.
publication of the 5th edition of the Textbook of Occupational Medicine Practice. As a resident myself who have used the textbook, I found the textbook extremely readable and also useful to provide a comprehensive coverage on the breadth of knowledge required for occupational medicine practice. And in addition, the textbook also provided up-to-date information on occupational medicine practice following the COVID-19 pandemic. Readers will definitely find the textbook useful for their training and their learning as well.
So pardon me about that. We'd like to thank everybody for their congratulation messages from everyone. It's been meaningful to the launch of this textbook. Now, let us begin with our discussion session. You may be free to switch your cameras on now. I'd like to have the editors of this book, Professor David Ko and Gan Wee Ho, to start the discussion with the thought of their book. If anyone has any questions, please feel free to put them in the question box. If not, then our guests will be leading our conversations. Thank you very much, Professor David and Dr. Gan Wee Ho. You can start with our discussion.
Right. Thank you very much. But before I pass on to Prof. Ko, I thought that I just wanted to say on behalf of all of us here, I wanted to
thank Matthias, Professor Matthias Stoll, for being our guest of honor today and for your kind words. And I see that, so thank you very much, Matt, for being part of this event and helping to be our GOH. I also see many friends in this group, contributors, and as residents, and of course, even well-wishers. I think Prof. Chu Chin Hin is also online today. So thanks, Prof. Chu, for attending. It's been an awesome experience. As you can hear, as you heard from many of the sharing earlier, this is the 5th edition, and Prof. Ko has been involved in every single one. So by comparison, I'm a newbie because I was a chapter contributor in the 4th edition, with Prof. Ko's encouragement, took on the editorial part of it as well for this current edition. So it's been a huge learning experience for me, and I think for all of us, it has been, I think must be a memorable one, very memorable one, because we did a bulk of this in over the COVID-19 pandemic. And I recall, as I was discussing with Prof. Ko some time ago, we reached out to each and every one of our contributors in April 2020. And that was really in the early part of the COVID-19 pandemic. And since then, about 2 years, slightly more of the 2 years have passed. But within that period, I am certain all of us have been very deep into the action of a COVID-19 pandemic. And in spite of that, all of you, especially our contributors, have taken time, effort, energy to update the respective chapters and even to write new ones. So for that, Prof. Ko and myself are extremely grateful to all of you for your contributions. I also would like to thank Alvin, who is also online today. Alvin has been part of the editorial assistance team, working alongside Prof. Ko, myself, World Scientific, to proofread many of all the chapters, in fact, multiple times. And it is, again, no mean feat because he's juggling with his occupational medicine residency training at the same time, plus many other commitments and academic pursuits and others as well. So thanks very much to Alvin for doing this. I hope, I know that you have learned a lot and you certainly have contributed a lot to this textbook. Alvin, you want to switch on your video if you can? And just, yeah, I'm not sure whether Alvin is not convenient at this point, but anyhow, yeah, there he is, Alvin. Thank you so much. You saw him on the video and you see him now in person. So I just wanted to once again express our, thanks, Alvin. Express our thanks and gratitude to each and every one of you. And before I pass to Prof. Ko, I just thought that I will also make a short admin announcement, which is towards the end, at the end of this session, we are going to take a group photo. So I hope that you will get yourselves ready so that when World Scientific requests us to turn on the videos, you'll be ready. And okay, all right, over to you, Prof. Ko. Thanks very much.
Thank you, Dr. Kan.
Thank you, Weeho, and thank you everyone for joining us today. It's so wonderful to see so many friends and contributors to this book. I think it has been a great effort from everyone, and without everybody's help, this book certainly won't have seen the light of day. Weeho has been, in particular, very excellent co-editor. He did a lot of the work. Thank you very much, Weeho. He's also mentioned Alvin and all the other wonderful contributors, many of them who've sent very kind messages, and some of them who've joined us today. So thank you again, everyone. It's good to see everyone here today.
Thank you, Dr. David. I might ask you both a question, if that's all right.
Sure.
Yes, of course.
In an increasingly urbanized world and workforce, how will occupational hazards and medicine develop in the future, for example?
Prof.
We all can answer. We all knows all the answers.
Okay, all right. Well, I think, okay, I certainly didn't know this question is coming, but yeah, I think we all know that the world and the future of work has changed and will continue to change and evolve. In many parts of the world, we are seeing a combination of not just traditional occupational diseases and injuries, but we are also seeing overlaid upon it new occupational health challenges with new work patterns, with new work hazards like nanomaterials, nanoparticles that's increasingly coming to the fore. And even we know that they are even part of our day-to-day products. So going for, and not to mention about the fourth industrial revolution, and with greater mechanization, digitalization, we are going to see a whole new pattern of occupational health diseases. And we are already seeing the huge impact on the whole body, very fast accelerating body of knowledge, and how to manage that and its impact on the mental health of workers. And henceforth, we can no longer just look at proactive diagnosis, early diagnosis and management of these conditions, but increasingly occupational medicine must grow to encompass occupational health and include that preventive part of the entire management into our practice. And one other point which I would like to add is that with the fourth industrial revolution, where data is becoming more pervasive, and we are getting data from many more sources than the traditional biological parameters that we know of. We are getting data from the usual moments of life, very invisible data collection and information that allows us to have a very longitudinal view and continuous and real-time view of a person's work patterns, of a person's biological, physiological status. We are able to then deploy a lot of current technologies like artificial intelligence and machine learning to even predict occupational hazards even before they occur. Or even a person's state of alertness, for example, before the person lapses into a state where it is he or she is unsafe for work. So there are many new developments on many different fronts in occupational medicine and occupational health. And I hope that not just our generation, but the generations that is to come will continue to embrace these new challenges, emerging challenges, and not just embrace them, but work on them and be at the very forefront of research, translational research, to make really the workplace and work much safer for everyone. Thank you.
Thank you very much.
That's a pretty long answer. Apologies for that.
That's fine. We have a few congratulations in the chat. Professor, we have a guest, Retanswawi S. Masamlani. Apologies if I said your name wrong. Professor David, he says, very nice to see the only clinical textbook on occupational medicine globally launched. And that's congratulations to both of you. If there is no more questions, we move on to the last slide. Thank you, Sukling. If you're keen to know more about the book, it is available to be purchased at a special discounted price of 40% on the World Scientific website using the promo code shown on the screen. You can scan the QR code and I will put the link to the website in the chat box now. And it should be available to see now. And this offer is valid for today only. Before we end the launch, we will take our group photo now. So if you will be free to put on your cameras, please. And on my count, Sukling will generously put a screenshot of us in the chat. All right, is everybody ready?
No, it's just wonderful to see so many people on the screen now.
Yes. Okay. Sickling, are you ready?
Yes, I am.
All right. So on my count, 3, 2, 1, smile.
All right, all good. Thanks.
Thank you. Thank you for everybody for attending. And once again, thank you to Adjunct Associate Professor Matthias Bulto, Professor David Koh, and Dr. Gan Weho and all the contributors for taking the time to share our thoughts for this launch. Thank you very much and have a good day. Goodbye.
Thank you. Bye.
Thank you very much. Goodbye.
Thank you, everyone. Thanks for
Bye.
attending.
Thank you.
Thanks,
Bye.
everyone.
Bye. Bye.